Good evening, everyone, and welcome back to Livayo Talks. I'm your host, Preetika Karnik, and today we'll be exploring joint health with Dr. Jyoti Lakhani. So, the fast paced lifestyle of today has resulted in an increase in joint health issues affecting people of all ages. You may have seen multiple internet memes about people in their 20s complaining about knee and back pain. While some attribute the prevalence of joint problems to factors such as lazy lifestyles, poor standing and sitting postures, and a lack of proper nutrition, others attribute it to age itself. So, today we'll have a detailed discussion on managing joint health and to gain a better understanding of maintaining joint health. So we are joined by Dr. Jyoti Lakhani today, who will share her insights on how using Ayurveda can help us maintain optimal joint health. So just to give you guys a quick introduction to Dr. Jyoti, Dr. Jyoti is the founder and chief physician at Ayur Healing. It's an Ayurveda and Panchakarma clinic in Kolkata, and she has more than 15 years of experience in clinical practice, research, and education in the field of Ayurveda. She holds an MS in psychotherapy and counseling, Bachelor of Ayurveda Medicine and Surgery from BAMS from Karnataka University, and Rajiv Gandhi University of Health Sciences, Bangalore, respectively. She has expertise in treating both acute and chronic cases using only classical Ayurveda formulations, along with Panchakarma, meditation, and yoga. And today we are honored to have her live on this session of Joint Health with us. So, welcome, Dr. Lakhani, and thank you so much for being here. So, without further delay, let's
Yes,
kind of dive.
thank you.
Thank you, Dr.
Can you
Jyoti.
hear me, Pritika? Audible?
Yes, Dr. Jyoti, you are audible.
Okay. Thank you for inviting me.
Always happy to have you, Dr. Jyoti. So, before we dive into a few questions, let's just go through some statistics to understand the gravity of the effect that joint pain has on our lives. Now, one statistic says that 50% of the people above the age of 65 have different levels of joint pain. So 50%. Two out of five women and one out of three men suffer from osteoporosis. 30 to 50% of adults over the age of 65 suffer from the condition of osteoarthritis. And both genders are affected by this disease or osteoarthritis. A worldwide estimate says that 9.6% of men and 18% of women, so almost double the amount of women aged above 60 have symptomatic osteoarthritis. So, keeping these data points in mind, let's get some guidance from Dr. Lakhani. So, Dr. Lakhani, what exactly is joint pain? How would you describe this?
First of all, I would like to thank you, Livayur, for putting such a platform for the common people to know Ayurveda so well. Actually, it is, I think, need of the hour that we should know, we should have an idea that Ayurveda can cure everything. In fact, can prevent every disease. So, joint pain is very common. What is joint pain is basically it is one of the very common problems, especially among the elder ones. Okay, so clinically, it is characterized by the inflammation, pain of different kinds, pain with the swelling, pain with inflammation, pain without swelling, pain on walking, pain without walking, early morning stiffness. Then there are plenty of different symptoms you will see, sign and symptoms in a patient who is suffering from joint pains, having different variety of joint pains in them. But Ayurveda described this treatment in the management of joint pain, such as we can use different therapies like Snehan, Swedan, or correcting from your metabolism till the use of topmost treatments called as Panchkarma. So joint pain is very, one of the reasons why people are coming to Ayurveda in a very, uh, like people love to come to Ayurveda very much because no other science can give the relief from joint pain as Ayurveda does, because Ayurveda has that root thing in the mind, that from where this inflammation is coming out, from where this stiffness is coming out. We are not just suppressing the symptoms. In Ayurveda, we are just trying to reverse the condition from where it has originated. So the treatment part and everything, the diagnosis part and everything is entirely different. So that's about joint pain, and we have a different joint
Absolutely.
pain. Yeah,
Absolutely. Thank you so much, Dr. Lakhani, for also bringing up the point that Ayurveda doesn't only suppress symptoms but goes to the root of things. We learned this from our diabetes webinar as well. You can head over to the Livayur Facebook page to see that video. But even with very severe diseases as well, Ayurveda goes to the root of the problem. Now, I'm sure whoever experiences joint pain experiences it so much that it feels almost normal to them, almost a part of their life कि हाँ दर्द तो होता रहता है. But I'm sure joint pain is not normal. Any sort of recurring pain is not normal, right?
absolutely. It is not normal. So in Ayurveda, we have that target in mind to relieve the patient from the symptoms, not only related to this joint pain. If there is a joint pain, then there must be some other things are also connected. If you see diseases these days, now you will not find one disease in one particular person. It has multiple connection with it. So in
Absolutely.
Ayurveda, we have that target in mind. First, to relieve the stiffness, the pain, the inflammation, so that the person can lead his normal life. And nowadays, it is like within 3 4 days, we are just helping people to at least walk properly. People are
Okay.
coming with the condition where they're not able to walk, they're not able to reach a clinic itself. It
Okay.
is
Okay.
like
So
the
it's a bit
condition.
severe.
And
It can
first thing in our mind is to just make them easy for them to at least next time if he comes to my clinic, he has to walk and come easily.
okay.
So
Okay.
keeping that in mind, our thing is we are trying to make it easy for people to at least give them relief, give them, give them relief from the sign and symptoms they are suffering from, especially the pain one, which is obstructing them to do their normal works, their daily routine, that is obstructing them to go out, to meet people, and plenty of things. It has psychological effect as well, especially the rheumatoid
Absolutely.
arthritis if it converts. And the minus point is if you ignore joint pains for the longer time, it goes into degeneration. When
Okay.
it goes into degeneration, it takes another further form. Then we
Okay.
have to deal with two things: inflammation and at the same time degeneration. That is
Okay.
why any disease which becomes chronic, it takes much time to relieve. Still, I am always telling people that Ayurveda has a solution, even though how much chronic the pain will be, how much degeneration it has caused, Ayurveda has the solution.
Got it. And speaking of Ayurveda, Ayurveda is a holistic kind of science and treatment that you spoke about. So, what is Ayurveda's perspective on joint pain?
See, in Ayurveda, it is very simple that pain is the sign of Vata dosha. Reason may be anything: your metabolism, your digestion, or your like your undigested food in your body, which is called as or toxins in your body. Reasons are
Okay,
so many. We will discuss that also in detail. But the
sure.
thing is, in Ayurveda perspective of view is we have to correct the thing which is causing it. Okay? So Vat dosh is the main factor which is causing the pain. But
Okay,
why Vata dosha is getting obstructed? The thing is there is movement. Vat is meant to be do the movement of circulation in the body. If
okay,
there are some undigested food stored somewhere in the body, suppose we are talking about knee joint. If there is swelling, there is inflammation, or there is undigested food settled down in the knee joint, so the movement of Vat will be obstructed. The Vat
oh,
is trying to move. That is why it is putting pressure and the pain is coming out. So what we
okay,
are trying to do is relieving the path. We are just cleaning the path so that
okay,
the Vayu can move on its own. The circulation can be done properly. At the same time, toxins has to remove from the path. So that reduces the inflammation. In Ayurveda, it always depend upon the stage of the disease. It has in the acute form, or either it is in chronic form, or the inflammation is there, and the edema, if it is there, which kind of edema is there, pitting or non-pitting, and then which prakruti the person has, which, like, there are plenty of things which we have to take care, that you will come to know when you will go to an expert Ayurveda physician. And by this medium, I will try to tell you the maximum things which you can also take care at home also. And then if
Okay.
you need, you can go to a Ayurvedic doctor.
Okay. So you mentioned how the Vat dosha enables that kind of circulation. And is there any way I can find out what my dosha is? Is there any tool or anything
Yes,
out there?
yes, yes. For that, I was telling this in last this webinar also, live session also, that you should always go and check your Prakriti. Prakriti is something which never changes in your life until
Okay.
unless you're going to die. That Prakriti will change. Otherwise, the Prakriti of the person from the birth till the death remains the same. So everybody has a dominance of few doshas. You always check in between your Prakriti. Prakriti not only tells you the normal things, sometimes like the Prakriti tool we have in Livayurna. So that
Okay.
also tells you which dosha is extreme or dominant or imbalance. So you will come to know plenty of things about yourself. So always go and check. Livayur has a very good tool for checking your Prakriti, your Vata, Pitta, Kapha dominancy in your body. By that, you know your Prakriti, and you can see your body like that, and you can give your body the things which is required by your body. Everything is not meant for every person. So by
Absolutely.
getting to know about your Prakriti, you will come to know, and you can prevent lot of diseases actually.
Okay, okay. I think the team can drop in the link to the dosha tool from
Yeah.
Livayu. So whoever is curious can go in, check your dosha, and seek out Ayurvedic help if required. So, Dr. Jyoti, coming back to the causes of joint health. What are some common causes other than what we discussed already? Poor lifestyle, bad posture, things like that. What are some other causes of joint pain?
See, the joint, if I'll talk about the detail of Ayurveda, we should always know that joint pain is due to some cartilage destruction or inflammation. Okay? If it
Okay.
is very severe, if it is not
Okay.
severe, then it is the starting of inflammation. There is some rigorous movement between the bone endings, between the joints. Because of that, it is the pain is occurring. Otherwise, one of the major reason, if you talk about, your reason is your agni. Agni means your indigestion. Your digestion is one of the biggest factor. So in Ayurveda, whenever we talk about the causes of joint pain, so if your agni is not working properly, that is one of the major reason for
Okay.
your joint pain. Number one. Number two, consumption of excessive cold, dry, bitter, and pungent food. Irregular
Okay.
pattern of your lifestyles. Not doing any physical exercise on a proper time. Exercise after eating of your food. ठीक है.
Okay.
Then awakening at night and sleeping in the daytime, in the afternoon, especially after eating the food, which people have very good habit. I mean, this all comes under irregular pattern of your lifestyle basically, है
Okay.
ना. So excessive traveling,
Okay.
excessive walking, the people have the habit of just एक बार शुरू हो जाते हैं वर्कआउट भी एक्सेसिव करने से वात प्रकोप हो जाता है, ये लोगों को पता नहीं है. These days workout is very common, like people
Okay.
are crazy and pagal about their body.
Yes.
Body shaming is a lot. So they don't think about the things which are attached to it. They just keep doing without thinking that their body is required by those things or not, your body needs those things or not. Are you able to, it's in your limit that you're doing this up to the maintenance of your health, or you're going beyond that. So
Correct. Correct.
we need to focus on those things. Then lack of sleep, which is very common these days. People are into phone. जब आप phone देखते हैं, we just just scroll and कितने घंटे निकल जाते हैं, no one has the idea. So it
Absolutely.
gives it doesn't give your body to heal itself. It doesn't give time for the body to heal itself. All the time your brain, your body is working, either even though you're just lying down and scrolling the, but your brain is working. If your brain is working, that means your whole body system has to work. So you
Correct.
don't get time to correct yourself or heal yourself. Body doesn't get time to what do you say, अपने आप को थकावट से रिलीव करने का टाइम नहीं मिलता. हमको हमको लगता है हम लेटे हैं, बट बॉडी को वो टाइम नहीं मिलता है. It's kind of machine which is working 24 into 7 almost these days. Then there is genetic factors in few patients, you can see that also. At the same time, eating very fast, or eating very slow. One of the reasons, along with this, these are the reasons by which your agni will be disturbed. You have ama in your body. Ama is toxins which is made at the end of your digestion. The end product of the digestion should be only two part. One is your waste product and one is your rasa product, which is being utilized by the body for the nourishment, for the working of the proper body. Another has to go out. The one which doesn't go out properly remains in the body in the form of toxins. So in this way, what happens, your body, that the toxins like moves or circulates throughout the body and stays in one of the joints in your body
Okay.
and start causing a disease.
All
So
right.
that is called as, now there are two types of like, we'll talk about that also,
Sure.
like how this toxins is going to make that. So basically what happens, aggravated arm dosh blocks the channels and
Okay.
reduce the supply of nutrients to that particular part.
Okay.
And because of that lackage, the inflammation starts, the stiffness starts, the swelling starts, and finally the pain starts. These is the condition which leads to these things.
Understood. And we learned that, how Agni, consumption of the wrong food, exercising too much are all factors. Just wanted to ask are there any ethnological factors? Meaning, if I am other than maybe genetics, tied to genetics, but any ethnological factors,
Which factors?
etiological factors?
These are the factors. These are the
Got
factors which I told you. These are all the factors which are responsible for causing joint pain. I told you rigorous exercises,
it.
lack of nutrition. I'm telling you, I'm completing that in one cause only. There, like if you go to the detail of nutrition, there are a lot of nutrition. But the thing is, if your food is not being digested properly, and if a organ or joint is devoid of getting the proper nutrition, the degeneration part starts.
Okay.
That part is not getting the proper nutrition. It is coming from your digestion. So one of the biggest reason is that. That's why the calcium and the other supplements and all that. In few patients, if you give supplements also, it doesn't work. Why? Because their digestion is not good. Because their
Okay.
digestion is not able to digest those supplements also. For giving your body a proper, proper nourishment, you need to have a very good digestion. So all these comes under the etiology of joint pains.
Understood. Understood. Now, I'm sure, people who exercise, maybe, let's say I went on a walk today after a very long time and I didn't stretch or something, and sometimes occasionally my knee will pain or my shins will pain. So I know that, okay, maybe because I did this walk after a very long time, it's paining. But are there any early signs of joint pain that can turn into chronic joint pain? Is there any early signs to watch out for?
Yes. See, common symptoms: stiffness, swelling,
Okay.
and pain. These three things we don't have to ignore anytime. If it
Okay.
is like at the age of 35, you are standing for like 15 to 20 minutes or like half an hour, and you
Mhm.
start paining on your lower back, or you
Okay.
start paining on your knees, or you start paining on your feet, that means your body is not able to do that. That means there is some problem with your joints, some
Okay.
problem with your bones, or some problem with your nerves. So we need to rule out at that time itself why this has happened to me. This is not the age for these things. These days, if you're seeing small kids, they don't have the stamina to stay for a longer time or longer time. Pritika, am I audible
Correct.
now? Yeah.
You are audible, Dr. Jyoti. You are audible.
Yeah. So the thing is, these are the very early signs which we need to understand. Like if
Okay.
you sit on the ground and you're not able to get up on your
Okay.
own, that is very early sign of your this thing. Another is when you are sitting in a position for longer time and still your body is paining, your joints are paining. That is one of the signs, the early signs of joint pain. Plus, when you fold your legs and sit in what do you say, um, normal look, crisscross position of your
Mhm.
body.
On the
And
ground.
if your knee, if you have to change your leg position, or if you feel slight tenderness or kind of little stiffness in your knee joints, that are the early signs of joint pains. We need to rule out all these things. or picking up something and put like the pain in the shoulder joint.
Okay.
And if you walk for a longer time, you feel pain in your legs when you're coming home. So at very early age, we need to understand there is something wrong going on in my body. We need to correct that.
Okay. So, as we discussed in the beginning, continuous pain is not normal. Even if you're doing daily activities like sitting down or standing up or trying to pick things up, if you feel pain, please don't ignore it. Please pay attention to it and reach out to a professional if you feel like, something is not right. Now, coming back to the questions, we saw that there are joint pain that can happen to it through many different ways. Are there different types of joint pain according to Ayurveda?
Yes, there are different joints pain. We have like, there are different parts of your body wherever the joint is. We call them the particular joint. Like suppose we have a pain in lower back, we say it is uh, kati shul.
Okay.
In Ayurveda give the name shul. है ना?
Cool.
Shula is the term which we use for pain. And we have, if it is occurring because of arm is indigested food, which is very common. We call it as rheumatoid arthritis. There are symptoms which rule out, which is rheumatoid arthritis, which is osteoarthritis. Rheumatoid arthritis can later be converted into osteoarthritis. Osteoarthritis is a condition where pain is the major symptom. Pain with a degenerative changes. Degenerative changes, matlab, what do you say? Uh, uh,
Rubbing.
Rubbing of the joints, and that is causing the degeneration of the joints with them. And that degeneration occurs more if you work more of, or if you work more, or if you use your joints in a, like, that pain increases whenever you work or when you walk, when you do more work. And in Amvat, the symptom is very typical. It is early morning stiffness. Early morning stiffness is when you
Okay.
get up, you're not able to move your legs or your feet. And with the passing time, you will start feeling normal. The stiffness
Okay.
more and the pain will be in the early morning. And the in Amvat, there will be hotness on the joint. Whenever you touch the joint will be very hot. Whereas in osteoarthritis, the joint may be hot or may not be hot. Because if it is with rheumatoid arthritis, then it might be hot. If it is not with rheumatoid arthritis, then it might be cold because
Okay.
of Vata dosha. If Pitta is involved, that means the arm is there and then it becomes very hot. So
Okay.
it is like fighting between the two things. Vata is trying to move and arm is trying to obstruct it. This kind of fighting thing causes the pain, at the same time stiffness and the inflammation.
Got it.
So
And
these two different, majorly we see this kind of two different types of joint pains in the body. Whereas osteoarthritis can start with the smaller joints, and it takes itself into the bigger joints also. Whereas rheumatoid arthritis always starts from the bigger joint. It
okay.
starts from the knee joint and like elbows, or your, like it starts from the bigger joints, and you were unable to move your hand like this. There's a stiffness in the joints. So that
Okay.
is rheumatoid arthritis. So we need to rule out these two. So rheumatoid arthritis usually we cure by changing the lifestyle and correcting the metabolism. Whereas
Okay.
osteoarthritis, we need plenty of things. Okay.
Understood. Understood. And once again, we come back to the dosha uh, part over here, and please refer to the dosha tool if at all you have any curiosities about your own dosha here. So, are there, Dr. Jyoti, any specific Ayurvedic treatments coming to the treatment aspect of things?
Yes.
We've learned that there are two different types of joint pains that can happen. We've learned about how joint pain can happen. Now, finally, coming to okay, I have joint pain. Now, how do I treat it? So, Ayurveda wise, what are the treatments for joint health?
Yeah, there are plenty of treatments. Ayurveda has, I think, the best solution for joint pains, or I think the best treatment for any disease, particularly for joint pains. Since the we should know little more about the type of joint pains we have. It involves two types of vat, which is one is Vyan vat. I know I told you that pain is because of vat dosha in your body. At the same time, the synovial fluid, which lubricates your joint, is the form of Shleshma kapha. Kapha ki type, one type of the kapha dosha. It's that type. So only Ayurveda knows that all these types of Vata Pitta Kapha are being formed by the proper digestion. How your body is coping up with everything. So first thing which we do is we correct the metabolism of the person. We try to improve the digestion. We try to take away all the toxins from the body. There are different ways can be done on different kind of patients. A patient who is able to correct his diet properly with the proper workout, with proper medicated waters we give for, like, drinking, or removing toxins from your body. If person is able to just correct his lifestyle with very few simple things, that is our first line of treatment, and that works like 70% of the treatment.
Okay.
Then we add few medicines. Like, there are different medicines we use, the formulations such as like Rasna, Saptakam, Maharasna, Dikwa. There are different Dashamulkwat, and then Mantaram, Kashayam, and Sacharadi. All these, like, these are all the classical combinations of medicines which can only be used under medical supervision. Koi could say,
Okay.
please, on this platform, I'm telling you that please don't take all these medicines. You have no idea which medicine is for which condition. In Ayurveda, nothing like that. That Brufen is only for pain. No, in Ayurveda, it works very different. It works on the type of stage of your disease. Your disease is in initial stage, or it has come to a chronic stage. What it has covered, it has embedded into the dhatus, or it has taken the seat into the deeper tissues, or what stage it is. So for every stage, the treatment will be different. If you have osteoarthritis, if suppose you have no idea which kind of medicines you have to take, and you have an rheumatoid arthritis, and if you take sheer balatilim, that will further disturb the condition, because in rheumatoid arthritis we need to detoxify the person first. We don't need to give them the nourishment of the treatment. We don't give them they're over nourished kind of people. So
Okay.
we cannot give them the medicines which again nourishes the body, or which increase the nourishment to the body, because that nourishment will not reach to the proper organ, since it is obstructed with the arm. So
Okay.
for rheumatoid arthritis, the treatment बिल्कुल different है, is entirely different. For that, we need to correct their metabolism, remove the arm first, and then we can start with some medicines. And there are mostly dry treatment. If we have to do the external therapies, we do external therapies in rheumatoid arthritis and osteoarthritis also. The difference is, in osteoarthritis, we use which nourishes that part, because there is degeneration. So we try to nourish that part, also depending upon the agni of the person. It's not
Okay.
only degeneration. Then again, there is a factor that in rheumatoid arthritis, we don't nourish. We don't give oils. The oils which we use are entirely like Sandavadi Telam or Maha Vishgarbha Telam. These are two different varieties of oils which doesn't nourish, which tries to dry the arm in that joint particularly.
Okay.
So in osteoarthritis, we use Mahanarayan tel, Kshirbal tel, then plenty of Bala tel, plenty of oils are there, which we use external treatment. But in rheumatoid arthritis, it absolutely differs. So there we have to correct the condition first, and then we can go. Here we have to see that inflammation is there. If inflammation is there, again we cannot give something which nourishes the body, because
Okay.
first we have to bring down the inflammation, and then bring down the digestion to its normal condition, and then we can start giving some pain or anti-inflammatory, or something which nourishes the body. So
Okay.
medicines only can be used by an, like, Ayurvedic professional who has this knowledge of stages and type of disease, and where what can be given. Then in Ayurveda, we have a very good Panchkarma therapies through which we can use. Basti is one of the very good treatment for joint pains. Basti is actually in Ayurveda, if you see, we have five main Panchkarma therapies. Among them, the Basti is best for Vata dosha.
Okay.
Since pain is the major sign of joint pains, major sign of joint pain. So for any kind of pain, Basti is the best treatment. So Basti also,
Let's see.
depending
Okay.
upon the type of Basti treatment, is putting some oils or herbal decoctions like in the bladder, or in the bladder of the patient. And that is the treatment which because he knows what is the use for the suppose it is matter, and you're using all bus using the bus which the body just So these are the
Okay.
varieties that we have. So in Ayurveda, we use different kinds of oils like castor, we use shatavari, triphala, we have jalaki, we have eucalyptus, we have devdam. You can find medicines or combination. Best treatment for pain or vata, because shunti at the same time is very good at digestion. So in most of the diseases the digestion is not good, so shunti helps in
Okay.
relieving of the pain as well as it helps in improving your digestion. It improves your agni stage also. So these are the combinations which can be used by the doctors in different conditions. Okay.
Okay. Okay. One quick question
One more
from the
thing I
audience.
want to tell, that in rheumatoid arthritis, constipation is very common. So
Okay.
relieving of that is very important. So in that,
Absolutely.
castor oil plays very important role. Yeah. So in
Okay.
rheumatoid arthritis, most of the patients are having constipation. So we need to correct that also.
It's honestly fascinating how everything is connected, and you can't view one thing in isolation, and Ayurveda
Yeah.
very clearly teaches us that so well. Just coming to a quick question from the audience, we have a question that asks, is there any Ayurveda product that provides instant relief like any of the allopathic sprays and ointments?
Yeah, we have sprays. We have so many things. You go to Jandu Care, you will come to know that Ruma Seal is one of the product. There are see, it is not about telling people the product. I don't want to mention on this national platform that it is not right thing to just prescribe, because every person again has a different condition and different stage. So there are plenty of formulations. Jandu only have like plenty of formulations which are very good for. You will find all those at Jandu Care and other pharmacies. There are plenty of like medicines available, and especially our classical medicines are best. But I am telling you again that medicines doesn't work in the way your correction of your metabolism and your digestion does. This is my practical experience, that even though the person is having severe pain, you start with a simple diet and hot water, you see the pain relief in next day with some external oleation or external therapies. Within 1 or 2 day you will see the patient relieved by 50 or 60%, more than that. So there are
Wow.
so many medicines. I cannot take the names of them openly over here. For that, they need to come and consult me or any other Ayurvedic physician around you. Go and meet them. They will tell you the right solution. Ayurveda doesn't take time. It only like within a week, if you don't feel ki your treatment is very good or you're getting your symptoms relieved, then that means you're not taking your Ayurvedic treatment properly.
Okay, okay. So audience, if you'd like to consult with the wonderful Dr. Jyoti, you can go to Livayur, and the consultation can be set up through that as well if you have any pains. One more question is, after a night's sleep, you wake up with some back pain, but it does go away. I think you had mentioned that, after sleeping, some joint pain that goes away. What can we say about this?
Yeah, if it is regular, then there must be some changes in your body happening. And if it is like once a year or once in twice or in a year, or it only occurs when you stress a lot or when you work physically a lot, like standing together for 10 hours, 8 hours, so you need to rule out the things why it is affecting you. If it is regular, like every day, if it is happening, then it is a concern thing. You need to show to, like, go to your doctor immediately. If it is happening sometimes in a here, it is very much common. Still, you should not ignore that. If it, like, just do some exercises or just take light diet, have warm water, just detox yourself for some time, and you see it goes off automatically.
Understood. I hope the audience members have also gained some insight on this. Now, coming to what we always do, which is dietary recommendations from Ayurveda, because we've discussed extensively how the agni, the digestion, all of that makes such a difference to joint pain. And in fact, you also mentioned that one of the main parameters that you treat is making sure this person's lifestyle, this person's diet is good. So from an Ayurveda
See, the diet,
perspective, yes, please go on, Dr. Jyoti.
yeah. The thing is, we need to think what is, see, there are different diet these days. The dietitians are very much into demand. Okay? So, but I think an Ayurvedic expert knows the better form of your body than anybody else. You need to check your pulse, you need to check your dosha state, you need to check your dhatu state, you need to check your disease stage in your body, you need to check your body, what your body is going through, is your body is capable of working on the things or not. So depending upon person to person, in general I will just recommend, which I always do, that always go for the diet which is nutritious, which is scientific, which is very easy to digest, which brings all the important factors in your body which is required every day and doesn't cause harm. Harm means intoxicate, like indigested food or undigested food or toxins in your body. Any diet which is compiled of shad dhatu, shad rasa, like suppose if we'll talk about the balanced diet, they talk about what carbohydrates, this, that, and that. But in Ayurveda, the balanced diet is the diet which is made up of shadras. Shadras means katu, tikta, madhura, amla, lavana. The which has all the rasas in it. We should include the we should include all the rasa, like rasa which is little kadwa, which is little tikha, which is little khatta, which is little mitha. All these things which is salty. So combination of this six shadrasa yukt ahar is the best ahar for the
Sure,
person.
sure.
At the same time, include green vegetables a lot.
Okay,
Green vegetables, it are very easy to digest because they have, I think, all the nutrition required by a human body, even for the joints, for improving the shleshma kapha, which is responsible for the, this movement of the joints properly, which give that
sure,
fluid, synovial fluid. So all those things are being, if you take your diet properly, like, सबसे important baat through this is get up early, do some joint exercises also. First thing you will do is have some little warm water, not more than like half a cup of water. You
okay,
start your day with the warm water and then you do some exercise. Don't eat until you're hungry. That is first thing. If you're not able to do the hard exercise, at least you do the joint rotations, movement as much as you can. I am so sure that if you start with simple Ayurvedic medicines or with the Ayurveda treatment by correcting your metabolism, we give some medicated water along with that. In the next week, you'll be able to do your at least your movements properly, the joint movements, the workout, the walk. So this kind of treatment includes the proper carbohydrates like your roti. Roti is very good. Wheat को आजकल सब लोग like brand wheat, this wheat, that wheat में ये होता है, wheat में वो होता है. Nothing. Don't go for that. Eat
okay,
what your ancestors have eaten. They were
correct,
fine. They were fine. They never had these diseases. So
correct,
don't go for people. I think the best scientists are your ancestors. They might have seen something
absolutely,
in that diet, so that is why they were taking that. Always go for that diet. Sometimes you add good. Don't take anything regularly.
sure,
Avoid
sure,
curd and milk. I am telling you, everyone, that animal protein we all should avoid,
okay,
especially for the persons those who have bad digestion. Your body is not able to digest that. Again, they sit in your body in the form of toxins and they create disease. That's it. So try to avoid the things which doesn't suit you, which doesn't required by the body, which doesn't suits to your particular digestion. So
okay,
diet should be, or your daily routine should be like that, which suits to your body, which is required by your body,
okay.
depending upon your dosha, your dhatu stage.
Okay, okay. So thank you for that extensive, knowledge nugget sharing session today. This finally brings us to the end of this webinar. Truly enlightening, Dr. Jyoti. Always lovely to have you here. We are sure that our audience has gained valuable insights from this session, like all our sessions, I can say. We extend our heartfelt gratitude to you, Dr. Jyoti, for sharing such comprehensive information that I can see truly comes for the heart because you treat patients every day and that care always comes through. We'd also love to express our gratitude to the audience for joining us today. Remember, you can visit Livayur website to have a peep at our social and have a peep at our social handles for regular updates about Ayurveda, the Ayurvedic lifestyle, and honestly, all the tips and tricks to include Ayurveda in
Yeah,
your
even
life.
even I want to tell people that go and find all the articles in Livayur. There are plenty of things you will come to know about your daily things, and it will help you a lot. Just go and see, and if you want your consultation also, you can go to Livayur. We have the consultation tool also there. You can find that. You can get your appointment and you can get the consultation also.
Absolutely. Thank you so much, Dr. Jyoti. Thank you,
And if
everyone
you
who's
have any queries, you can ask us later also. We'll
yes,
be able to,
absolutely.
we'll try to reply all your queries.
Yes,
Thank you,
please.
Mayur, for this platform. I think through this, I'm trying to tell what actual Ayurveda is. I'm not telling you any book reading thing or what are the symptoms we see in Shastras. I'm telling you everything which I'm seeing every day, which I'm treating every day, which is helping people every day. So I think through this platform, people will have their actual knowledge about Ayurveda. They will have their actual, they will know their actual situation and they'll work on their actual situation. So I hope this helps everyone. Thank you.
Thank you, everyone. Thank you so much for watching. See you on the next webinar.
Thank you.